Have you ever woken up in the morning feeling like your mouth is completely dry, your tongue feels sticky, your throat feels rough, and the first thing you need is water? If this is happening to you every single morning, your body is not just being annoying, it's trying to send you a message. And today, I'm going to break down what that message could be, based on medical research and what doctors commonly see in real patients. Let's start with something important. Dry mouth, medically known as xerostomia, is not just about feeling thirsty. Saliva plays a huge role in your health. It protects your teeth from decay, washes away bacteria, helps you digest food, and keeps your mouth tissues healthy. When you consistently wake up with a dry mouth, something is interfering with that natural process during the night. The first and most common reason is mouth breathing. If you sleep with your mouth open, air constantly flows through your oral cavity and dries out your saliva. Many people don't even realize they breathe through their mouth at night. Why does this happen? One big cause is nasal congestion. Allergies, sinus infections, a deviated septum, or chronic sinus inflammation can block your nasal passages. When your nose is blocked, your body automatically switches to mouth breathing. Another major cause is snoring and sleep apnea. In obstructive sleep apnea, your airway partially collapses during sleep, leading to loud snoring and repeated pauses in breathing. This often forces you to breathe through your mouth. If your dry mouth is combined with loud snoring, choking sounds at night, morning headaches, or feeling tired even after a full night's sleep, your body might be warning you about sleep apnea. Sleep apnea is not just about poor sleep. It is linked to high blood pressure, heart disease, and even stroke if left untreated. The second possible reason is dehydration. If you're not drinking enough water throughout the day, your body reduces saliva production at night. Alcohol and caffeine make this worse because they increase fluid loss and dry out tissues. If you drink tea, coffee, or energy drinks late in the evening, that could be contributing to your morning dryness. The third reason is medication. This is one of the most overlooked causes. Many common medications list dry mouth as a side effect, including antihistamines for allergies, antidepressants, anti-anxiety medications, blood pressure drugs, and even some painkillers. If your dry mouth started after you began a new medication, this could be the reason. Never stop your medication suddenly, but do talk to your doctor about possible alternatives. The fourth reason could be high blood sugar. Persistent dry mouth can sometimes be an early sign of diabetes. When blood sugar levels are high, your body tries to remove excess glucose through urine, which increases urination and leads to dehydration. If your dry mouth is combined with excessive thirst, frequent urination, blurry vision, or unexplained fatigue, it's important to get your blood sugar checked. Sometimes, dry mouth can be linked to autoimmune conditions like Sjogren's syndrome, where the immune system attacks the glands that produce saliva. This is less common, but if you also have dry eyes, joint pain, or persistent fatigue, it should not be ignored. Now let's talk about why this matters. Chronic dry mouth is not harmless. Saliva protects your teeth and gums. Without enough saliva, bacteria grow faster. This increases your risk of cavities, gum disease, bad breath, and even oral infections like thrush. People with chronic dry mouth often notice more dental problems over time. So what can you do? First, check your breathing. If you suspect mouth breathing, try to clear nasal congestion before bed. Saline nasal sprays, steam inhalation, or allergy management may help. Second, stay hydrated throughout the day. Don't wait until you feel thirsty. Limit alcohol and caffeine, especially in the evening. Third, review your medications with your healthcare provider. Fourth, consider using a humidifier in your bedroom. Dry air can worsen mouth dryness, especially in winter. Fifth, practice good oral hygiene. Brush and floss regularly, and consider alcohol-free mouthwash designed for dry mouth. If your symptoms are severe, persistent, or combined with other warning signs like heavy snoring, extreme fatigue, or frequent urination, don't ignore them. Your body whispers before it screams. Waking up with a dry mouth every morning might seem small, but it could be pointing to something bigger, from simple dehydration to sleep disorders or metabolic conditions. Pay attention to patterns. Notice what you drink, how you sleep, what medications you take, and how you feel during the day. Your body is always communicating. The question is, are you listening?